This is AONM's webinar on Breathe Easy, Maximizing the Benefits of Oxygen for Better Health and Wellness. And we're delighted to have Dr. Sarah Myhill with us again. She's an intrepid genius, as you know, in every way. She'll be talking today about a new topic for us. We haven't had her speaking, primarily on oxygen so far. I'll just introduce her for anybody who doesn't know her. Dr. Sarah Myhill qualified in medicine with honours from Middlesex Hospital Medical School in 1981 and has since focused tirelessly on identifying and treating the underlying causes of health problems. She has worked in the NHS and private practice, and for 17 years was the Honorary Secretary of the British Society for Ecological Medicine, which focuses on the causes of disease and treating through diet, supplements, and avoiding toxic stress. She helps to run their lectures regularly on organophosphate poisoning, the problems of silicone, ME, and much else beyond. She's written 3 original scientific papers in highly reputed journals on the role of mitochondria in ME, as well as being the author of multiple prize-winning books. She's also the clinical director of the College of Naturopathic Medicine, the medical director of 𝐃𝐄/MFA, which is the UK Medical Freedom Alliance, and the assistant editor of the Journal of Orthomolecular Medicine. So we'll be having a presentation from Sarah for about half an hour, and then she'll be answering your questions. So please put them into the chat or the Q&A. And so that's over to you, Sarah. Thank you very much indeed. And thank you everybody for being here.
Thank you, Gillian, for that very nice introduction. Let's start talking about oxygen then. So let's just screen share that. There we go. So I hope that you can all see that. So that's who I am. I think you all know me. And of course, anybody who knows me knows that I have a special interest in chronic fatigue syndrome and ME. And both of those conditions are characterized by poor energy delivery mechanisms. And oxygen is, of course, a part of that. Now, the analogy I love to use, and you'll probably all die from boredom when I say this again, is the car analogy. And this is what we need for our car of a body to go. You need the diet, which is all about the fuel in the tank. You need the mitochondrial engine. But for the engine to burn that fuel, whether it's ketones or sugar, it doesn't matter, it needs oxygen. And when you burn fuel aerobically with oxygen, you can make anything between 32 and 36 molecules of ATP, the energy molecule. Conversely, if you burn fuel without oxygen, you can only make 2 molecules. So guess what? Oxygen is very important. And then for all that to happen, we need, as I call it, the thyroid accelerator pedal and the adrenal gearbox. But this evening, we're going to concentrate on oxygen. I'm going to whiz through these slides, and then there'll be plenty of time for anybody to ask questions. So these are the symptoms of when oxygen supply is low. And I worked for 10 years in general practice in Annesley, Woodhouse and Newstead during the 1980s. And pneumoconiosis was, a very common problem, because guess what? All those poor miners were occupationally exposed to huge amounts of coal dust that wrecked their lungs. And, oxygen, even I know what happens when my cylinder runs out. And the symptoms of poor oxygen delivery are all the symptoms of poor energy delivery mechanisms. For example, physical fatigue. And these people with serious lung disease who just simply didn't have the surface area to absorb oxygen, they were very severely fatigued. They couldn't move out of their chairs. Mental fatigue, because the brain needs a liberal supply of energy to work well. Obviously, weak muscles, because muscles need oxygen to function. Poor energy delivery to the heart. Poor detox, poor immune system, and ultimately organ failures. So oxygen is, as you know, awfully important stuff. So let's look quickly at the science of this. So, of course, it's essential for aerobic metabolism. Now, oxygen is inhaled in the lungs. Once inhaled in the lungs, it then hops from the lungs onto hemoglobin, which is in red blood cells. And they literally glow red in color when they're saturated with oxygen. That blood then circulates around the body until it finds a busy cell. And there the oxygen pops off hemoglobin in order to go to the mitochondria so that the mitochondria can use oxygen to burn fuel. And that the red cells then turn a slightly bluish color, and those red cells return to the lungs in venous circulation. So the big question is, how is it that oxygen knows to get onto hemoglobin in the lungs and hop off it when it gets to a mitochondria where it's needed? Because if it was the other way around, then, that would be a disaster. That would mean the whole thing would fail the whole system would fail very quickly. And the answer to this question is acidity. And the acidity in the blood is generated by carbon dioxide. So when mitochondria are busy, when they are burning fuel in the presence of oxygen, they generate carbon dioxide. Carbon dioxide dissolves in the plasma as a weak carbonic acid. So the plasma becomes acid and the hemoglobin becomes slightly acid. And in acid circumstances, hemoglobin dissociates, the oxygen hops off and it supplies the mitochondria. And of course, that's a totally desirable state of affairs. By contrast, in the lungs, as we exhale, we're washing carbon dioxide out of the lungs. And in doing so, the blood becomes slightly alkali. And if the blood is slightly alkali, then oxygen sticks onto hemoglobin. So this obviously makes perfect physiological sense. And this is such an important idea that I'm just going to repeat myself here. So lungs, low carbon dioxide, alkali blood, so oxygen sticks to hemoglobin. Conversely, in the mitochondria, which of course is every living cell in our body, high levels of carbon dioxide, acidic blood, so oxygen is released from hemoglobin. I say, totally desirable state of affairs. Now, all this works perfectly until we upset carbon dioxide levels in the blood. I mean, one of the things I've always asked myself is, why did we evolve such an inefficient method of breathing? If we really wanted to be incredibly efficient about gaseous exchange, then we'd have lungs like a fish, where the air comes in one way and it goes out another way. But by breathing in the same air that we exhale seems, very inefficient to me. And the answer is that without that, we would lose too much carbon dioxide. So respiration is, yes, it's about getting oxygen, but it's all about hanging on to carbon dioxide so the acidity of the blood is just right. Now, we get into problems when we overbreathe. And many people, for many reasons, overbreathe. It's often driven by the stress hormone adrenaline. And of course, we all know what the major cause of adrenaline is, and that's falling levels of blood sugar. So when people are fueling their body on sugars and carbohydrates, their blood sugar goes up and down and up and down. Every time their blood sugar goes up, there's an outpouring of insulin in order to bring blood sugar levels down, and that sugar is shunted into fat. Then blood sugar levels fall precipitously. The brain panics. Where am I going to get my next fuel from? And there's a spike of adrenaline. And one of the effects of adrenaline, in addition to high blood pressure and feeling stressed and wild but tired, but one of the effects is it can drive respiration, so we end up over-breathing. Now, of course, from an evolutionary perspective, this is a very desirable thing, because most stressful situations for primitive women walking through the jungle would have been followed up by, running a mile, sprinting, and therefore oxygen would have been highly necessary. But for most of us, most people, they hyperventilate. They're not using up ATP, and we have the disastrous metabolic effect is we wash carbon dioxide out of the bloodstream. And therefore blood becomes too alkali, and therefore oxygen sticks to hemoglobin, and there it remains stuck. So your oxygen levels in the blood can be very good, they can be 100%, but if your blood is too alkali, then the oxygen remains trapped on hemoglobin. So mitochondria are starved of oxygen and symptoms result. If you starve mitochondria of oxygen, they go slowly, and maybe you go into anaerobic metabolism. And these are all the symptoms of poor energy delivery, which I'm not going to repeat, but the point is, if you don't get energy to your brain, the brain goes slow. If you don't get energy to your body, the body goes slow, and so on. But there are some symptoms of hyperventilation that give you a clue that this is the issue. And the first thing is people often mouth breathe. Now, the problem with mouth breathing is there is what I call dead space. what we should all be doing is nose breathing. And therefore, as we exhale air, more of that exhaled air is therefore re-inhaled. So we hang on to carbon dioxide better when we nose breathe than when we mouth breathe. And of course, if you are mouth breathing, then you end up with a dry mouth. You can also end up with tooth decay and gum disease because microbes in the mouth love oxygen. But another really interesting facet of long-term mouth breathing is it actually changes the anatomy of the jaw and the face, because the body is incredibly responsive to various stresses. And if we nose breathe, then that opens up the nose, opens up the airways, and allows the jaw to develop properly. And what we see with people who breathe through their mouth is nose obstruction, crowded teeth, and an undershot jaw. So the pressures in the upper airways actually pull the whole shape of that, and chewing, of course, pull the shape into shape, the whole of the face and the mouth into shape. Sinusitis. If you're mouth breathing, you're not aerating your sinuses well, and therefore there's a tendency to be blocked. And it's the old story: if you don't use it, you lose it. The more you mouth breathe, the more you breathe, the more your nose becomes blocked. And again, the more the nose becomes blocked, the more you mouth breathe. And we'll talk about breathing exercises in a little bit. Snoring and sleep apnea, because again, the upper airways are not inflated properly. They become a bit edematous. They're prone to collapse. And that can result in either obstructive, it can result in obstructive sleep apnea, i.e. snoring. Asthma, all asthmatics hyperventilate. 𝐕𝐈𝐃𝐄, and we're going to talk about the 𝐕𝐈𝐃𝐄 methods, was a Ukrainian and fought very bravely during the Second World War, and then got involved in hospitals subsequently. And he noticed that many of the people he was looking after, he wasn't a qualified doctor at that point, he just observed this through his own, using his own common sense. And he noticed that many of the people who had breathing problems were actually hyperventilating. Now, at that point, he didn't understand the mechanics of it, but he seemed to instinctively know that to teach people to slow down their breathing, doing the breathing exercises could be helpful. And guess what? It was remarkably helpful. And the 𝐕𝐈𝐃𝐄 exercises and asthma, the bronchoconstriction of asthma probably represents an attempt by the body to retain CO2. But unfortunately, it has the opposite effect. So again, 𝐕𝐈𝐃𝐄 exercises, which we'll talk about in a jiffy, very helpful for asthma and very helpful for chronic obstructive airways disease as well. Instead, if you do have anybody with chronic obstructive airways disease, that might be blocked nose, stuffy nose, polyps, sinusitis, this is so often allergy as well. And as a routine, avoid dairy products, because dairy products are markedly, they have a great tendency to produce catarrhal conditions. And again, I'm a great fan of iodine, but we'll come on to that. Another clue here is when you are, if you're not delivering oxygen efficiently to the tissues, it drives the autonomic nervous system and we get imbalances there. So too much sympathetic drive puts it into fight or flight mechanism, which with all those symptoms associated there: blood pressure, tachycardia, feeling wired but tired. And you get too little parasympathetic action, which is all the what I call the rest and digest, or what we call the rest and digest functions, and poor gut function. Now, there's another really important part about this, because when people hyperventilate, broadly speaking, they're using the wrong muscles to breathe. They're using their chest muscles to breathe instead of the diaphragmatic muscles. Now, so learning diaphragmatic breathing is going to be very, very important. And it's important for at least two other reasons. I was intrigued. I mean, one of the questions I've always asked myself, and not really knowing the answer to, is how does blood get back to the heart? We know how the blood gets from the heart. The heart pumps, it creates a pressure, and so do the arteries, and that pumps blood, around the system to the capillaries. We know how blood circulates through the capillaries, and that has much to do with fourth phase water. It's basically, there's no physical pressure difference between the arteries coming in, the veins going out. It's driven by electrical forces. But how does blood get from the veins, of the veins in our legs, for example, back to the heart? Because, where's the pump that does that? And the answer is the diaphragm is very, very important here. Now, all veins have valves in them, so the blood can only go one way. And what the diaphragm does as it descends, as we breathe in, is it squashes the veins in the abdomen, and that pushes blood into the chest cavity. So the positive pressure in the abdomen as we use our diaphragms, and the negative pressure that generates in the chest shoots blood into the chest cavity and therefore back to the heart. So effectively, it's sucking blood. I mean, we can see how venous blood can return from the head and the neck and from the arms. Gravity, of course, is very helpful. But the diaphragm is the main pump that sucks venous blood back into the chest cavity so it can be recycled. And I was fascinated to learn that the diaphragm is actually heavier than the heart. So the diaphragm arguably does, as much work as the heart does, because, of course, it's not just venous return that's important. It's also we need the diaphragm to inflate our lungs. The other thing that the diaphragm does is it massages the whole of the gut. So the liver, the pancreas, the spleen, the kidneys, it stimulates blood flow in the gut and also lymphatic circulation in the gut. So the diaphragm is a much more important organ than I think anybody we've really understood. And symptomatic of that is when people who had serious COVID were put on ventilators, of course, that ventilates the lungs in a completely incorrect way. It ventilates the lungs on a positive pressure system rather than a negative pressure system. And we know putting people on ventilators was very unhelpful for people with severe COVID. It didn't do them much good at all. So, and another important thing to note here is that people often use, or physicians and therapists often use a pulse oximeter to measure levels of hemoglobin in the blood. And a big one to measure levels of oxygen that's on hemoglobin. And that's what it does. It doesn't measure oxygen delivery to the tissues. That's another thing. So, if you are hyperventilating, your blood could be 100% saturated with oxygen. But if the oxygen can't get to the mitochondria to do the business, then you're going to suffer all the problems of poor energy delivery mechanisms. So good oxygen saturation does not mean you've got good oxygen delivery to the tissues. So now we know how to diagnose overbreathing. We've got the clinical picture there. So how do we prevent it? And essentially, these are 𝐕𝐈𝐃𝐄 exercises. He was a very clever man. We'll touch on him in a moment. And the first thing, and there are three aspects to this. First of all, learn to nose breathe, and always nose breathe, even if that means taping your mouth at night. Secondly, learn to breathe with your diaphragm. And thirdly, slow the breathing down. Now, if your nostrils are a bit blocked, let's say cut out the dairy products, and then open up the airways, maybe using wintergreen or eucalyptus or something like that, and then once open, sniff iodine. I'm so cross with myself. I've just realised I left my salt pipe up in the summer house. But sniffing iodine through a salt pipe is extremely helpful for almost any respiratory problem, because iodine is both anti-infective, so it contact kills all microbes at 10 parts per million. So anybody with an acute infection or a chronic infection, chronic sinusitis, pharyngitis, laryngitis, bronchitis, bronchiectasis, chronic obstructive airways disease, sniffing iodine is incredibly helpful. I've now got 5 patients with chronic bronchiectasis who, before coming to see me, went from one infection to one antibiotic and a bit better, and then another infection, another antibiotic and a bit better. And of course, you risk ending up with an MRSA, which is real bad news. Since starting on all the regimes that I do, ketogenic diet, supplements, and sniffing iodine, their need for antibiotics has dropped to nearly 0. So iodine is a great way to help keep the airways open. And learn to breathe in one nostril and then the other. That's the starting point of breathing exercises. What's so interesting is sometimes one's a bit blocked and one's a bit open, and sometimes the other one's blocked and it's the other way around. The nose itself sometimes shuts down one side and then the other side. But nature intends us to breathe through our nose. I can't think of another mammal that doesn't breathe through its nose at rest. All other mammals, my little dog, my horse, the sheep out there, the cows, they all nose breathe. Yes, if they're running for their lives, then they will breathe through their mouths, but at rest, 99% of the time, they're nose breathing, and so should we. So first of all, learn to nose breathe and clear out the nasal passages. And once they're cleared out, keep them shut. Even when you're exercising, even when you're walking around the garden and doing stuff, don't mouth breathe, keep your mouth shut. Okay, the second thing to do is to breathe with your diaphragm. And people who hyperventilate often use their chest muscles. We should use the diaphragm largely for all the reasons we've talked about. Improves venous return, improves parasympathetic function, it's a total and is actually more efficient. So those are how to do it. So initially, put your hand on your chest and put your hand on your tummy. And breathe. So this hand, this hand, which is my right hand, looks like the left hand on the screen. I have to say it must be a mirror image. So the hand on your chest anyway, stay still, and your hand on your tummy, comes up and down as you use your diaphragm to breathe. So that's the second part of the exercise. And the third part is to slow your breathing down. And normal activity, we should be breathing 5 to 6 times a minute. But when we do these exercises, aim to slow the breathing down. Now, the reason we do this is because that increases carbon dioxide levels in the bloodstream, and therefore the blood becomes a little bit more acidic, and that greatly improves oxygen delivery to the tissues. So that's why we're doing these. And it takes a little bit of practice. So we have to make, you see, the respiratory center isn't sensitive to oxygen. It's sensitive to carbon dioxide levels. And initially, it won't like that. You will get a sensation of air hunger. Must take another breath in order to wash out that carbon dioxide. So you have to use these exercises to retrain the respiratory center to be happy by being a little bit more acidic. And it should be very easy to get the breathing down. So you're just breathing 3 breaths a minute. So those are the routine of cycles. You're welcome to have this handout. Start with the full cycle every 10 seconds and then to 15 seconds, and then to 20 seconds. I found it was even possible to get down to just 2 breaths a minute and feel quite comfortable with that. Whoops, I've jumped ahead of myself. I'm a shocker for doing this. But again, as I mentioned before, diaphragmatic breathing also improves the circulation. It's essential for venous return to the heart. And of course, cardiac output is proportionate to the stroke volume, the amount of blood entering the heart. So when we so when we breathe in, we're sending a jet of blood into the heart. And therefore the stroke volume increases, and so the heart beats a little bit faster. And so what you will find is as you breathe in, the heart rate increases a bit, and then as you breathe out, it slows down a little bit. And a measure of this is called the heart rate variability, the degree to which the heart rate varies from one beat to the next. And if you've got a good heart rate variability, that tells us, if you've got a large variability, that tells us you're healthy. And I think it's a reflection of diaphragmatic breathing. You've got diaphragmatic breathing that impacts directly on the heart rate variability. There are other things you can do to retrain your breathing. Singing is very good. People who sing learn breathing exercises, humming, playing an instrument, dee-da, dee-da, dee-da. But again, when you're out in the garden or walking and jogging, try to keep your mouth shut. And I say it's difficult. I now know that I was a mouth breather. I now know that I was probably prone to hyperventilation, and so I work hard on this too. And one of the characters who learned this from 𝐕𝐈𝐃𝐄 directly is an amazing athlete called 𝐕𝐈𝐃𝐈𝐒. And his first Olympics that he went to, I think, was 1952. And at that Olympics, he trained running by nose breathing. He kept his mouth shut. He made his respiratory center very tolerant of carbon dioxide. And what that meant is that his oxygen delivery to his muscles was very good. And as a result of the learning the Wim Hof method, he became a very successful athlete. I think it was the 1952, he won the 5,000 meters gold medal. He won the 10,000 meters gold medal. And then he decided to have a go at the marathon. He'd never even run a marathon before, let alone win one. And he won gold medal in that too. So it worked for him. Now, the opposite of slowing down the breathing, the opposite of 𝐕𝐈𝐃𝐄 is Wim Hof breathing. And I'm sure many of you have heard of him. He is a quite extraordinary person. And he essentially does the opposite of slowing breathing. He does hyperventilation and then hold the breath. And I ran a Wim Hof weekend at my home here, and we didn't have Wim Hof himself, unfortunately, but we had colleague Dr. Dar, who's a superb trainer. And what's so fascinating, after forced hyperventilation, it's then very easy to hold your breath for maybe 2 or 3 minutes. It's quite extraordinary sensation. And my guess is the reason why hyperventilation is good is because it stimulates endogenous endorphins. That's only a guess, but I mean, the sensation certainly equates with that. Here's a picture of Wim Hof, who climbed up Everest. He seems to be able to control his autonomic nervous system through his breathing techniques. And that means he can control his body temperature consciously, or he's learned to control it consciously, his heart rate, his breathing, and that allowed him to climb Everest with, in a pair of shorts and sandals. I mean, it's just mind-blowing what that guy does. So, in summary, to get oxygen to our mitochondria, we need to breathe less. We need to do the 𝐕𝐈𝐃𝐄 breathing techniques, which is nose breathing, breathing with your diaphragm, and slowing your breathing down. And when you have arrived, when you've got it right, because of what's called a controlled pause. And the way you do that is when you're just, whatever you're doing normally, breathe in normally, and then breathe out slowly, until air hunger says you've got to breathe again. And you should be able to get to 40 or 45 seconds fairly comfortably. I can just about get a bit of a gasp at the end, I have to say, but that tells you that your respiratory center is then tolerant to the carbon dioxide, and you've done a good job of retraining it. So I hope that that's just that. And the other point is, how often do we have to do these exercises? I don't like asking my patients to do interventions, which are time consuming, difficult, cost lots of money, These breathing exercises anybody can do. Do them first thing in the morning when you wake up. When you're sitting down watching the television, do them then. Last thing at night before you go to sleep, do them then. So they become part of your regular everyday routine, and then you just incorporate it into your life, and then you find you've covered another base. Okay, so we can stop sharing now so that I can see you all. If you'd like to, okay, thank you, Gillian. Do you want to read out questions, Gillian, or do you want me to go through the chat box, whichever's easiest for you, whichever you prefer?
I'll read them out and sort of
Perfect.
try to bunch them. Fantastic. Thank you so much. And so counterintuitive, I think, for a lot of us.
Yes, absolutely.
Yeah, very much so. So I'll go right to the beginning of the questions, because a few touched on that counterintuitively right at the beginning, which is, I'll read here. The first real question actually was, so then our system of breathing is not at all efficient after all, as it keeps the blood acidic. If this is what we want, then why are the goals of so many diets to make the blood more alkaline?
I don't know.
It is what one learns as a naturopath.
I know. And again, I would love to see that, backed up by some science. But I mean, essentially, we need the blood to be acidic in the tissues and alkaline in the lungs. So I suppose it begs the question, where are you taking the blood test from? So the blood that is arterial blood that's going from the lungs to the tissues is going to be slightly alkali. Mm-hmm. Conversely, the blood returning is going to be slightly acidic. Mm-hmm. Now, so I suppose it depends where you take the blood from. But no, I've never quite understood that, I have to say. One possible, I don't know if this is implicated, but all our body, everything that we excrete, so that's saliva, urine, feces, stomach acid, is all acidic. And all those acid secretions become acid because we're pumping protons. And that means what's left behind is alkali. So maybe if the blood is alkali, that means we can infer from that our secretions, our saliva, our urine, our feces, our sweat is all slightly acid, and therefore the proton pumps are working well. I don't know, but I've often heard that said, and I agree. I don't quite get the logic of it either.
Interesting. Another question: does nose breathing promote the use of the right muscles to breathe? Is that why there's
I don't think so. I can't see a relationship there. I mean, nose breathing occurs because we're generating a negative pressure in the thorax, in the chest. And, you know, what we're trying to do with these exercises is to generate that negative pressure, but not with the chest muscles, but with the diaphragmatic muscles. And if you're doing it with the chest muscles, that's the sympathetic nervous system, you know, kicking in. And if you're doing it with the diaphragm, then that's the parasympathetic nervous system kicking in. So I can't see that a nose breathing is going to impact on which muscles are going to be used. Or have I got that question? Have I not misunderstood the question?
No, that was exactly the question. Yeah.
Okay.
How important is posture?
Well, it's important for lots of reasons. You know, I mean, I don't pretend to be any expert in posture, but for example, people with ankylosing spondylitis who are very crushed over like that, then it's going to be very difficult for them to breathe correctly. And I think that, you know, I can imagine now if you're upright, your shoulders are back, then it's much easier to use your diaphragm to compress your abdomen than your chest. Whereas if you're cramped over, then your diaphragm is going to be a bit squashed. So and again, 𝐕𝐈𝐃𝐄𝐈𝐒 always recommends that we start off learning these breathing exercises when we're lying horizontal. So then we're nice and straight. You can see the tummy muscles coming up as the diaphragm's being used and the chest being still. But as you get the hang of it and as you learn the technique, then of course you can do them when you're sitting up. You can do them when you're walking along. So it's but start off lying down. But yeah, these exercises would be easier lying down.
Do you suggest going to a course like Learn 𝐕𝐈𝐃𝐄, for example?
You can do, but you know, it's all, you know, time, effort, and money, isn't it? And there's nothing difficult about these courses, these exercises. There's lots of videos online. I'm quite sure of that. And the acid test is the controlled pause. When you get to the stage when you can take a breath and then breathe out slowly, and it's 30 or at least 30 and ideally 40 seconds without getting a real drive for air hunger. And that air hunger is driven by carbon dioxide levels building up. If you can do that, then you're not far off.
Thank you. Are these exercises safe for patients with a low ejection fraction?
What, from the heart?
Yes.
They should improve the ejection fraction, because partly what determines the ejection fraction is the venous return. And if you're using your diaphragm correctly, then you will get much better venous return into the chest cavity, and that will increase the ejection fraction. Now, of course, if you've got valve disease, if you've got a leaky mitral valve, then the ejection fraction is going to be less, and obviously that's not so good. Of course, the number one cause, or a major cause, of a leaky mitral valve is magnesium deficiency. And the reason for that is the mitral valve is like a letterbox with the blood going through, and then letterbox, you know, dropping shut. If the size of the letterbox is too big, so the letters, the swinging bit doesn't fit, then blood will leak back. So if the mitral ring, that is dilated too big, then blood will leak, and that is often magnesium deficiency. But broadly speaking, improving the venous return using your diaphragm should improve your ejection fraction.
Okay, thank you. What about people going outside for exercise or walking with a group of friends and talking to pass the time, which means they would have their mouths open? Is this something to be discouraged? Well,
no, I love people talking. It's great fun. But when you're talking, guess what? We are exhaling. So the key is, and I know I'm not very good at it, so inhale. So between talking, and then you can talk for as long as you like. And this is why singing can be a very useful exercise. I mean, you've probably heard some of those opera singers, you know, with their arias, and they start singing, and you think, when are they going to take a breath? And they just go on and on and on and on. And I think they must have fantastic breath control. And of course, they're using their diaphragms. But no, when you go walking, keep your mouth shut, breathe through your nose. And when you talk to people, I say you're exhaling then. So big breath through the nose and then chat away.
There's an interesting request here, which is, could we do a few practice rounds of the breathing exercises together, recommended, as you spoke really fast and not everybody's picked up exactly how to do it?
Yes, of course. So let me do it with my watch. And what we would do is start off with just a nice easy one, which would be for just, say, 15 seconds. And again, breathe through your nose, and broadly we breathe in for 4, and then we breathe out for, say, 5 seconds, and then you hold it for 6 seconds. So let's just do a 15-second cycle then. So in through your nose, 1,000, 2,000, 3,000, 4,000, stop, and then hold, and then gradually blow out. 6,000, it's another, so 10, 11, 12, hold it, 13, 14, 15, stop again. Breathe in, 1, 2, 3, 4, hold, 2, 5, 8, 9, 9, out, slowly, 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 out. In, 1, 2, 3, 4, hold, 6, 7, 8, 9, out, 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 out. That's a 15-second cycle. That should be fairly easy to do. And then once you've established that and you're confident with it, then go back to, then we can extend it. Let me just here find out the timing of this so we can just look at this slide again. Okay, here we go. So let me just screen share this bit of the slide. Oops, daisy, come along. There we go. So this is the oops, I think I shot one ahead. There we go. So so this is how you slow the breathing down. So start off. So normally at rest, most people do 5 to 6. Start with the full cycle every 10 seconds. Of course, being a hopeless optimist, I've jumped to 15 seconds. But get a clock, so a little watch, so that can give you an idea of the timing. And so here we go. Here's the cycle we've just done is every 15 seconds. So you breathe in slowly for 4 seconds, hold or breathe out very slowly for 6 seconds, and then so that gives us 10 seconds, and then hold for another 5 seconds before you breathe in again. I haven't explained that terribly well. I apologize. I don't pretend to be a respiratory a physiotherapist that specializes in this, but there's nothing difficult about this, and hopefully you should be able to get the hang of that very easily.
Thank you. Thanks very, very much. There was another question here, which is whether you can tell us anything about the BOLT method.
The BOLT method?
Yes.
What's that an acronym for?
Body oxygen level test, the BOLT score.
Oh, shame to say I don't know anything about that. I know about pulse oximeters, and I say the most important take-home message about that is that measures oxygen in the blood. It doesn't measure oxygen delivery to the tissues. So if you're hyperventilating, it looks as if your blood is saturated, but actually you're not getting oxygen to the tissues. And this is I think this is a major problem in asthma, because people have asthma attacks and they're told, oh, you're fine, your oxygen levels in your blood are absolutely fine. And they panic because they know they're not getting oxygen to their tissues. They feel as if they're not breathing enough. So they breathe even harder. They breathe through their mouths and they end up really hyperventilating, and that makes the whole thing worse.
Could I ask a quite long question here about asthma? As a lifetime asthmatic, I've learned to breathe very little to avoid breathing in triggers such as smoke, pollution, or pollen. I naturally hate deep belly breathing or meditative breathing. I've used a blue inhaler most of my life, which recently I learned triggers an adrenaline reaction in order to open up the lungs so I can breathe. I wonder if this is consistent, if this consistent daily adrenaline spike is detrimental to my mitochondria.
Well, the first thing with asthma is we want to find out what the cause of it is. And it's so often food allergies. Yes, we know you can get asthma from house dust mite and pollen and all that sort of thing, but so often it's food allergy, it goes unrecognized. And and the one that comes up time and time again, of course, are the dairy products. So and grains probably, and yeast follow close behind. So anybody I see with asthma, a paleo ketogenic diet is absolutely essential. And then sniff iodine, because often there's chronic infection in the lungs, and iodine is a great way to reduce the infectious load. And iodine is also mildly anti-allergy as well. So it's going to be helpful from that point of view. We know we need magnesium for the bronchi to relax. And in many casualties, especially in New Zealand, funnily enough, they often use nebulized magnesium sulfate to dilate the lungs and thereby dilate the bronchi, and thereby relieve the bronchoconstriction of asthma. Of course, magnesium has been dubbed nature's tranquilizer. It's very good for bronchodilating and vasodilating, of course. So a naturopathic approach to asthma, is going to be very helpful. And as you rightly point out, the problem with using the blue inhalers is they're all agonists. They're all mimic adrenaline, and they drive the panic and they drive the hyperventilation. So that too is a bit of a vicious cycle. So asthma is all about, working out what the allergens are. And for some people, they have to do a carnivore diet. If their allergens are unusual, it can be egg, of course. Well, it can be any. It can be any food, but grains and dairy come up all the time. So identify the allergens, use magnesium to dilate the airways, use sniff iodine to reduce the infectious load, and then use the 𝐕𝐈𝐃𝐄 technique to slow the breathing down.
And then maybe the blue inhaler won't be necessary.
And then hopefully they should not use the inhalers, exactly, or should not need the inhalers. I mean, another problem that I don't know if you remember David Fried, dear friend, he was consultant and reader in allergy and immunology at Salford. And he pointed out that, before these inhalers became widely used, in the 1930s, the 1940s, and 1950s, there was no such thing as asthma. Sometimes you get wheezy bronchitis as a child, and then then the child would just recover. And one of the problems with a lot of the beta agonists is they switch off the normal mechanisms for switching off allergy. So we don't desensitize, we don't become less sensitive to these allergens because adrenaline drives it, which of course is music to the ears of big pharma, because they want people to be using inhalers, in the long term. But okay, I do see in a very short-term severe situation, beta agonists are essential, but in the long term, I think they can be counterproductive. In the long term, we have to ask the question why. We have to look for causation.
Okay, thank you. Very, very helpful. A lot of questions about 𝐻BOT here, hyperbaric oxygen.
Okay, yeah.
So what do you think of it? And then a more targeted question would be, could hyperbaric oxygen therapy be bad for ME then? Because you're getting a lot of oxygen, yet it does seem to help sometimes.
No. The interesting thing about hyperbaric oxygen is it doesn't increase the oxygen carrying capacity of hemoglobin, and it doesn't impact on the acidity or alkalinity of the blood. What it does is the pressure of oxygen in the pressure chamber means you're carrying more blood in the plasma. It's just more oxygen is dissolved in the plasma. And I learned much of this from a wonderful respiratory consultant called Philip James. And he ran the hyperbaric oxygen unit up in Aberdeen, which was established, of course, to deal with the divers in the North Sea that were getting the bends. And when he realized the therapeutic potential of hyperbaric oxygen, he argued that all hospitals should have hyperbaric oxygen for acute cases of any arterial blockage, heart attacks and strokes. Because if you give them hyperbaric oxygen, the damage, of course, in a heart for somebody who has a myocardial infarction or for somebody who has a stroke is that there is no oxygen suddenly going to that tissue, and those mitochondria and that tissue die. But if you give them hyperbaric oxygen, then you increase the oxygen carrying capacity in the plasma, and you greatly reduce the area of tissue that is rendered ischemic. So he was an advocate of hyperbaric oxygen therapy for acute vascular events. But what hyperbaric oxygen will do is it will improve oxygen delivery to the tissues. And of course, many microbes are oxygen sensitive. So it's biologically plausible that it could help a chronic infection. But again, the problem with hyperbaric oxygen is, it's a lot of effort and it's quite expensive. So it wouldn't be a therapy I'd put at the top of the list. But I think the potential for harm from hyperbaric oxygen is effectively zero. And the potential for good is certainly there. And I would, I beg your pardon, Dundee, not Ninewells, I beg your pardon. I thought it was Aberdeen. But the potential for good is there. And I would do it on a second C basis, i.e. have a trial of hyperbaric oxygen. Is that patient improved clinically? And if they are, carry on. And if not, well, no harm to be done.
So it could provide a useful boost in recovery from ME CFS.
It's theoretically possible, yes.
Okay, thank you. There's quite a lot of questions about that. I'm trying to work out whether they've been answered. Should we not breathe in too much? Overall is one of the questions here, I think. How does this relate to hyperbaric oxygen therapy for ME? 99% oxygen by mask inside a pressure chamber. Should we not breathe in too much? Perhaps she means when you're in a hyperbaric oxygen chamber.
No, that won't impact, because as I say, hyperbaric oxygen doesn't improve the oxygen carrying capacity of hemoglobin. It increases the oxygen in the plasma. So it won't impact on the acidity of the blood. It won't make it more acidic or less acidic. But as I say, we know oxygen is toxic to some microbes, and so it may have a benefit for that reason.
Okay, and what's your experience been of taping the mouth at night to support nose breathing? Do you think that's a good
Well,
idea?
it's usually well tolerated. I mean, if you take the whole mouth with a very sticky bit of something or other, that might be a bit claustrophobic. I can see that might not be desirable. But just an inch of micropore, just over the mouth like that, most people can, tolerate that. And if they get desperate, if they feel claustrophobic, they can take it off very easily, of course. But usually it's tolerated fairly well.
And what do you think about using nose strips to open up the nasal passages?
That's rarely where the blockage is. The blockage is nearly always higher up in the nose. So holding the nares out is not going to make much difference. But the more you breathe through the nose, the more open that becomes. And as I say, sometimes it's useful to use things like eucalyptus or wintergreen just to kind of open the airways up. And then a sniff of iodine to help keep them open, and then keep breathing through the nose. Keep working at it. And, you shouldn't, when you breathe gently through one nose, you should hardly be able to hear the air going to and fro. When you're breathing normally through the nose, you certainly shouldn't be able to hear anything. So, it's the old story. If you don't use it, you lose it.
Thank you. This is an interesting one. I think the sort of synthesis of it is, can one use both the 𝐕𝐈𝐃𝐄 and the Wim Hof methods? I'll just read the question. I have ME and fibro. Have had those both for 30 years. I've been doing Wim Hof in the morning and 𝐕𝐈𝐃𝐄 before bed for a few years. I had to start easy with the Wim Hof breathing and still can't get past holding 80 seconds, but it's still making a difference, and 𝐕𝐈𝐃𝐄 helps me sleep. She can't do cold showers because she's severe.
And many people with ME can't do cold showers. And my guess, and it is only a guess, there's a physician in the 1980s called 𝐃𝐈𝐒𝐂𝐋𝐀, who was a great advocate of cold bath therapy and cold showers. And, I suggested some of my ME patients try that, and it made them worse. Mm-hmm. And my guess is that the mechanism of cold showers is they give the adrenal glands a huge kick. And because, cold water is a great shock to the system, and shocks like that are, the adrenal glands then swing into action to deal with that. And if you haven't got the adrenal reserve to generate a response, then I think it would just make you worse. And
do you think there is some mileage in using both methods together?
Oh gosh, absolutely, because they do different things. They do completely different things. My guess is that Wim Hof causes an outpouring of endorphins, of endogenous opiates. You ask any athlete, who's run 3 or 4 miles and, of course, has been breathing, very heavily, effectively, in order to get the oxygen in to run those 3 miles, they get an endorphin buzz after that. And my guess is that hyperventilation basically gives us an endorphin hit. And endorphins are very anti-inflammatory and make us feel, relaxed and happy and chilled out. So my guess is that's what Wim Hof is doing. But by contrast, 𝐕𝐈𝐃𝐄 is doing the complete opposite. I think that's, stimulating the parasympathetics, which is the kind of the rest and digest aspect of breathing, as well as improving venous return to the heart and giving our abdominal organs a nice massage at the same time.
Thank you. Going back to hyperbaric oxygen, because further questions have come in on that now. Would you suggest hyperbaric oxygen alongside other interventions in an individual with a family history of CVS and CHD?
Okay, there are much, much more important things you can do than hyperbaric oxygen. The main drivers of cardiovascular disease, cerebrovascular disease, is going to be arterial damage. And the 3 big drivers of arterial damage, one is sugars and carbohydrates, because if you're running your body on sugars and carbohydrates, you're regularly spiking adrenaline. And if you're spiking adrenaline, you are that will give you high blood pressure, and blood does not flow evenly through the arteries. You get turbulence. And when you get turbulence in the arteries, that damages the lining of blood vessels. And if there's high sugar there as well, sugar sticks to the lining of blood vessels, and that drives arteriosclerosis. So that's number one. Number two is having a high homocysteine. And if you've got a strong family history of arterial or cerebrovascular disease, you must get your homocysteine checked. Now, homocysteine is a marker of the methylation cycle, and we're damaging our bodies all the time, and the methylation cycle is how we heal and repair. And without good, efficient methylation, we can't heal and repair, and that, of course, is going to be very damaging to arteries. Your GP should be able to measure a homocysteine. If not, you can get it done on a do-it-yourself blood test at CERA screen, CERA screen. It costs £69. And I like to see the homocysteine between 5 and 10. If it's too low, that can mean the homocysteine cycle is going slow because it doesn't have the raw materials to function. And if it's too high, it maybe there's a blockage downstream. So it needs to be in that nice window of 5 to 10. And with age, our homocysteine tends to increase. It can be easily treated with B vitamins, methyl folic acid, 800 micrograms, methyl pyridoxal 5-phosphate, 50 milligrams, methyl B12, 3 milligrams sublingually. And then retest the homocysteine in, say, 3 months' time. And it should have normalized. If it hasn't, some people need methyl B12 by injection in order to normalize their homocysteine. But that is really important. And the third thing is inflammation. Anybody who has any inflammation for any reason will be damaging their blood vessels, and it puts them into a prothrombotic state. Inflammation and sticky blood go hand in hand. If you've got sticky blood, you've got inflammation. If you've got inflammation, you've got sticky blood. I think this has much to do with the fourth phase of water. But those three things are by far and away more important than hyperbaric oxygen.
Okay, thank you. And another viewer here says, when I've tried HBOT, I got an excruciating pain in my temple. Do you have any ideas why? I had to come out of the chamber.
Oh, well, if that happened, fairly soon after going into the chamber, I can only think it was a pressure effect. My immediate reaction is that it was a sign you've got a blocked sinus or maybe a blocked ear. A little bit like when you go up in an aeroplane or come down an aeroplane, you get sinus, you can get sinus pain, ear pain, temporal pain. My guess is that must have been a pressure effect. I can't think of any mechanism whereby oxygen would cause that symptom.
Thank you. And another question here is, while I understood your point about inhalers, what would you recommend doing in an acute situation? If someone is still oxygenating well, I could see holding off on using the inhaler and concentrate on getting the person to breathe slow. But what if the O2 sats really are low? I would think that the inhaler is necessary.
Well, the answer is you do it all. In an acute situation, of course you use the inhaler. Of course you work hard at the high ventilation exercises. And but the oxygen sats would only go low in a very severe attack of asthma. And in that case, yes, of course, that person needs oxygen and hospital care. If oxygen sats, in an acute asthma attack, go low, that's a serious attack. But for a relatively mild attack, it's the old story, do it all. Sniff iodine, do the Buteyko's exercises to slow things down. Do use the inhaler, keep calm, and that's your best chance of the attack going away. Nearly all asthmatics I've ever seen are in panic mode. If you've got a nebulizer, then nebulizing Epsom salts is incredibly helpful. Magnesium nebulizer is a proven benefit in acute asthma. And the interesting thing about magnesium, when it's nebulized, is the benefits of magnesium are over and above the bronchodilators. So, what it tells us, it's working in a way that is different from the inhalers. So it's the old story, you do it all. And then you ask the question, why? What is it that triggered that attack? What can we do to prevent it? Because that is so much more important than dealing with the acute attack.
Thank you. And then, because you've mentioned iodine again, just a few questions on it, because we haven't many really. Does it need to be 15%?
No, anything iodine.
Does it need to be Lugol's as well? Because there are many different kinds of iodine one can buy.
Well, I like Lugol's iodine because the iodine in it is volatile, i.e. you can smell it. And to get it into the respiratory tract, it needs to be volatile for obvious reasons, because then it goes in by inhalation. And Lugol's is incredibly cheap. Is the first, is invented in the 19th century, and it has stood the test of time. So it's a very good preparation of Lugol's. And the point here is, if you can smell it, you have a therapeutic dose. You can smell it, and the therapeutic dose that kills all microbes, and I believe is also anti-allergy, is 10 parts per million. So it's a fantastically useful intervention.
Doesn't sniffing iodine cause nosebleeds? One participant asked.
No, well, I mean, you'd have to have an awful lot of iodine. I mean, obviously, if you put a lot of iodine on, it can be a bit irritant. But the usual cause of nosebleeds is low-grade infection in the nose with staphylococci, and iodine contact kills that. So you can use iodine ointment, and that's called povidone iodine, and that's smeared into the nose, sometimes does the trick. But sniffed Lugol's iodine works just as well. As I say, contact kills all microbes in half a minute. It really is a fabulous antiseptic.
Thank you. Someone, I think, is probably worried that it usually says on the bottles not for internal use. She asks, can Lugol's iodine be taken internally as well as inhaled? Absolutely.
I have no idea why they put that on. I think it's just to, protect themselves from, I don't know what. But no, iodine is totally desirable. And my view is we should all be taking Lugol's 15% iodine, at least 1 and ideally 3 drops lasting at night. And iodine benefits us in so many different ways.
Super, thank you. Another technique here is mentioned called air energy machines. Do you know of those? And
I've heard of them. I've read about it, and in reading about it, I couldn't quite see the mechanism by which they were going to be helpful. Now I'm in contact with lots of lovely people, and if something like that had worked, I would have heard about it. I would have had some feedback. So I know I've been asked about it. I know I've looked. And I know when I looked, I thought, well, I can't see the mechanism by which, I can see this is going to be helpful. So I haven't gone down that particular rabbit hole.
Yeah. And she mentions activated oxygen. I'm not sure whether that's what air energy machines produce or not, but she says, can activated oxygen help with CFS?
Well, again, I don't know what it is. I just can't see how you can activate oxygen. I mean, we know ozone is a good antimicrobial, so maybe they're talking about an ozone machine. It's not something I have experience with, but ozone, has been used by many doctors, with very good results for killing infection. But I don't pretend to be an expert in that.
No, I mean, you've actually been emphasizing almost the opposite of that, which is the importance of carbon dioxide, which so few people really understand.
Carbon dioxide is the key. I mean, carbon dioxide has been described as a hormone. I'm not quite sure I get that, but the point is that is how we control the acidity of the blood. So the whole of lung function is not about getting more oxygen in. It's all about hanging on to carbon dioxide in order to keep the pH of the blood, so it's alkali in the lungs and acid in the tissues, and the right amount of alkali and acidity for most efficient oxygen delivery.
Fascinating that it's being so demonized in the current narratives, isn't it? My goodness. Another question about Wim Hof. Isn't Wim Hof a burden on the adrenals? So that's perhaps why it's not good to start with it when diagnosed with ME?
Well, I don't know if it's a burden on the adrenals, but as I say, my guess is that when you say Wim Hof, presume you mean the cold water therapy
the Wim Hof therapy.
Well, Wim Hof is 3 things. It's the meditation, it's the hyperventilation, and then it's the cold water therapy. So it's the whole 3 things. And my guess is that first of all, it's teaching the body to control their autonomic nervous system. Now, the autonomic nervous system is the bit that's done automatically. We don't have any control. Well, I don't have any control over my heart rate, over my temperature, but he's obviously developed these meditative techniques so that one can Now, I haven't gone that far down that particular, I don't do it often enough, but, he's controlling his temperature. So, he can dive in, in freezing cold water and stay there for minutes and survive. Conversely, he can go up, Everest with, with shorts and sandals. So he's obviously learned to control his autonomic nervous system somehow. But my guess is the immediate effects of hyperventilation is it's producing endorphins. It's a little bit like low-dose naltrexone. We know that the mechanism by which low-dose naltrexone works is it increases the body's endogenous production of endorphins, and they have good anti-inflammatory actions. So there are going to be several threads to the Wim Hof story. I don't pretend to be expert, in all of them, but my guess is that's the mechanism of the short-term effect anyway.
Oh, thank you so much. Well, we've reached the end of the hour already. I know it's gone incredibly fast. We've got so many questions still here that remain unanswered, so we'll save them all and hopefully have you back again soon. Huge thanks to you. Everybody is so grateful. One comment here: I'm a qualified breathworks coach, but they didn't teach half of this to us.
Oh, bless.
So much. Yeah.
And if anybody wants my handouts, then you're welcome to send it round, Gillian. There's no secrets on that.
Oh, thank you very, very much. And yeah, it's just going on and on with questions. So we will need to have you back on this topic. Absolutely fascinating.
My pleasure.
Just to mention briefly that our next webinar will be on the 25th of July on Tuesday, and it will be about a new test that we're running called ImmuPro, which is about food hypersensitivities. So we'll also be at the IPM, which stands for the Integrative and Personalized Medicine Congress next week, beginning on Thursday, and hope to see some of you there. Sarah, will you be coming along to that at all?
Which day is it?
Thursday, Friday, and Saturday at Westminster. It's right.
No, I've got something on that weekend. I think I'm going to the Pear Fest that David Jerring's running that weekend.
Oh yes, unfortunately they clashed. That's right.
There's clash there.
Well, thank you everybody for being here, taking time out on this lovely warm evening to be with us. And Sarah, thank you very, very much again. Hugely grateful. Everybody. My pleasure. Thank you, Gillian. You make my job very. The dog's gone. You make my job very easy, I have to say. Thank you. Thank you.
Okay.
Bye bye.
Bye bye. Bye bye.